Good day to our thesis instructor, Mrs. Jo Marie Salar, to our thesis advisor, Dr. Jasmine De Yunan, to our panel, ma'am, sir, and to our chairperson, good morning. In behalf of my group, I'm Meros Toricampo, and I will be presenting a review paper entitled Changing Needs and Demands of Travelers, a Post-Pandemic Outlook, together with my group, Ms. Lovelyn Agda, Ms. Mary Rose Anistakio, and Ms. Mary Grace Garzon. Without a doubt, the tourism industry is among the sectors that have been greatly by the COVID-19 pandemic. The closing of borders, airports, and hotels, as well as restrictions on mass gatherings, land travel, and related services across the world put around 100 to 120 million jobs at risk, estimated by the World Tourism Organization. In the first quarter of 2020, the period when the travel restrictions and lockdowns in most countries started, international tourist arrivals declined by 22%, resulting in an estimated loss of $800 in global tourism receipts. Totally or partially closed their borders for tourists. 65 destinations have suspended international flights totally or partially, and 39 destinations were implementing the closing of borders, example banning the arrivals of specific countries. Moreover, diseases of COVID-19 also affects the travel risk perceptions. These result in shifting the travel behavior of tourists, which significantly influence change in their travel intentions patterns, preferences that drastically drop the demand for tourism products and services. The study of health risk perceptions and behaviors of individuals regarding travel is important from economic standpoint, but also for public health reasons as travel poses a threat for the spreading of infectious diseases. The infectious disease of COVID-19 has a significant impact on economic development as the pandemic unfolds worldwide. This caused significant business disruptions, turned into an economic crisis that generates extra losses and opportunities. The vulnerability of the tourism sector to COVID-19 hinders tourism activity and operating system due to the implementation of public health safety measures such as quarantines, curfews, travel restrictions, and social distancing measures to curb its spread, according to Bakar and Rosby 2020. Since COVID-19 disrupted the mobility of tourist travel, the business of the tourism industry was basically without a demand, according to Dollar 2020, that made the sector's business to a standstill, resulting in job losses, bankruptcy in the industry, and economic difficulties, according to Helby and Fink 2020. Moreover, since the industry is sensitive to health and safety changes, the threats of the SARS-CoV-2 virus has a direct impact on tourist perceptions of travel that significantly influences travel plans and travel behavior. In addition, this pandemic has made it even more important to understand psychological factors, including travel decision making amid a pandemic that is still in a depth of examination. Comprehending tourist behaviors from cognitive and affective perspective is pivotal for destinations marketing in times of crisis, according to Saifi et al. Thus, corresponding organizations need to be well prepared in countering and recovering strategies. Recent surveys reveal that many tourists are still willing to travel after the COVID-19. However, tourist health concerns influence the degree of traveling intentions and acknowledge the conditions among destinations environment choices, according to Zhang et al. 2020. The revenge travel trend is one of the future scenarios in the tourism industry. Revenge tourist is someone who has a huge desire to travel again after weeks and months of lockdown, according to Peters et al. 2020. The concept of revenge travel is an idea that tourists will consider the trip as a gift. This, once it reopens, those travelers will add more destinations to their list of travels more beforehand, according to Octavania 2021. Zaman et al. 2021 study suggested that revenge travel is significantly influenced by pandemic fatigue. Simultaneously, revenge travel occurs as a consequence of tourist change decision-making processes that have been largely affected by the pandemic conditions. In the aftermath of the COVID-19 outbreak, states, including government regulators, airports, airlines, and aircraft manufacturers, among other stakeholders of the aviation ecosystem, developed in coordination with public health authorities a set of measures aimed at reducing health risks to air travelers, aviation workers, and the general public. These measures applicable to states, airport operators, airlines, and others in the air transport industry are designed to enable a consistent and predictable travel experience. They will also contribute to the efficient, safe, secure, and sustainable transport by air of an increasing number of passengers and cargo, and will minimize the risk of COVID-19 transmission between and among these groups and the general public. The implementation of these measures will facilitate and strengthen the global recovery from the COVID-19 pandemic. Part of the protocols includes providing the public and private sectors with insights and toolkits for interaction and implementation to ensure that people are feel safe. However, WTTC and its members and the sectors cannot guarantee 100% safety. It is paramount to have common rules. Ultimately, we envision a future of travel that is safe, secure, seamless, and provides an authentic and meaningful experience to the traveler across the journey, one which supports the livelihood of millions and contributes to sustainable economic growth. The protocols align with the private sector behind common standards to ensure the safety of its workforce and travelers as the sector shifts to a new normal. The Safe Travel Stamp was created for travelers to recognize destinations and businesses around the world which have adopted the safe travel health and hygiene. Global standardized protocols. From hand sanitizers in hotel lobbies to cabin crew in masks, localized lockdowns to contact tracing app. COVID-19 has transformed the world of travel. Amid closed borders and canceled flights, travel came to a virtual standstill with the United Nations World Tourism Organization declaring 100% of global destinations had implemented travel restrictions at the peak of the pandemic. The impacts of the COVID-19 pandemic have brought radical changes and enormous damage to global tourism, mainly for the following reasons. First, the systematic travel restrictions and preventive measures imposed by the government that discourages people to travel. Second, perceived COVID-19 risk influences travel anxiety, causing to change the typical travel behavior. These travel behavioral changes are driven by the travel fear towards the issues of safety and security resulting in cautious travel behavior. The affects traveler needs and preferences which removes the characteristics of the tourism demand. Nevertheless, tourists have various travel needs emerge to satisfy the safety and security needs. Several empirical pieces of evidence from previous studies indicated that travel risk has significant impacts on changing the travel preferences of tourists. Specifically, several studies revealed that tourists are less prefer the destinations with more confirmed cases of COVID-19 relative to their places of origin. At the same time, tourists are more prefer a destination close to home, according to Lee Gong Gao in Yuan 2021. These changing preferences also include shifting from mass tourism into private tourism with the importance of technology in search information on the travel stages for pre, during, and post-trip. Additionally, tourists are more likely to express their interest in destinations' hygiene, safety, security, cleanliness, and medical facilities when they decide for traveling to destinations. The COVID-19 pandemic seems to have a destructive impact on tourism industry. The pandemic not just halted the business operations but also has a great impact on tourist behavior. Tourism, a service sector dependent on tourist movement, their destinations, and travel preferences, as well as providing travel satisfactory and unique travel services. This paper explores the changing travel behavior of tourists during COVID-19, which influenced their travel needs. On the other hand, tourism demand has traditionally reacted to disasters through severe decline and changes, according to Page Som 2012. Hence, the process of recovering any force majeure situation requires research on the shifting tourist attitudes and perceptions to understand the changes in the characteristics of demand to predict the long-term survival of the travel and tourism business. Therefore, tourism services will evolve according to the changes in tourist behavior, decisions of suppliers and governments.